So, hi, everybody. Welcome to the broadcast. This is Evoke Therapy Programs broadcast. It's Monday, May 18th, and tonight's going to be an open forum. So, I have some pre submitted questions that have been given to us at previous webinars that we couldn't complete. So, we'll have those in our lineup. But also, please feel free to pass on any question you might have for tonight. And Malia, who is moderating this evening, will pass those on when there's time. I'm also welcoming in our new clinical director of our intensives program, Travis Slagle. So he's going to be joining me tonight and giving some of his thoughts on some of the questions. Let me get to the first question that has just been submitted this evening. It says, my son is at Evoke and just had a psych eval. The results are pretty grim, in our opinion, feeling overwhelmed with the multiple diagnoses. Any advice on how to deal? And I think that more specifically, this parent writes, persistent depressive disorder, unspecified anxiety disorder, cannabis use disorder, an early remission in a controlled environment, severe narcissistic personality features, ADHD, parent-child relational problems. You know, there's actually a broadcast and a podcast about this very concern that you have. This is our experience over time that, first of all, psych testing is problem focused. It's going to have a much greater emphasis on what are the problems, and it's going to really capture just about any feature that's showing up. So the first thing I want to tell you is it's not uncommon to feel overwhelmed by it. In fact, there's an idea in the field that these are not really meant to be read by lay people because they can be so overwhelming. But you're the parent of a client, and so you're provided these. But I think it's just, when we read them, we don't read them with the same, first of all, personal connection that you have, but we also don't read them with the same kind of intensity that it's probably coming to you. So I'll just say it this way very clearly. And Travis, I'll be happy to hear any of your thoughts. First of all, it's not unusual at all. It's a very common response. Psych testing is problem focused. And it's more about just trying to give the practitioner, the therapist, all of the various angles, all of the various symptom clusters, which we call diagnoses, that are going to help them to address. And as treatment goes on, those tend to narrow and become more focused and clear. But the testing is going to really capture any and all symptom clusters that a young person or an adult is going to show up on testing. Do you have any thoughts to add to that, Travis?
Yeah, I'd say that the most important thing on a testing report are the recommendations that come at the bottom. I think that that's where you can have strategies for finding solutions, because I think exactly what Brad said, it's going to be problem focused. The point of the instrument is diagnosis, and it's a diagnostician that's coming in and looking at these symptoms and giving them names. And I find and it's so overwhelming for parents. And I've been in so many conversations and meetings where the report can be overwhelming. And sometimes it can be delivered in a way that, as Brad mentioned, the language isn't written from a family or a parent's perspective. It's written from the perspective of a psychologist. And that's the purpose of the testing. So I think the recommendations is where you really want to tune in your focus and energy, because that's going to provide you some steps for finding some solutions and some hope.
Thanks. I like what you said, because it really does. It comes at you with a hammer, right? It's not something that's meant to be conversational. It's something that's a very strong, blunt diagnostic tool.
Yep.
Travis, I'm not even sure I know the answer to this next question because it's not my area of specialization. It says, do you have suggestions on resources, books for when a teen is diagnosed on the spectrum? Autism is new to our family, and we have struggled to communicate with our teen for years. Now the diagnosis makes sense, but we are looking for solutions on how we can support her through resources available. So it's not my area of specialization. I can get back to you on this. I can look at our resources and on the people on our team who specialize in this, but I don't know the answer to that question. I don't know if you have any experience and might know that.
Yeah, I think that there's a lot of different directions to go. I find, my experience, I got a lot out of reading Temple Grandin's work. because Temple Grandin is such a good writer. She speaks from a first-person experience of what it's like to be able to have different strategies and the different ways of accommodating for some of these deficits, and ultimately making these deficits into strengths. And so I think that Temple Grandin's work is where it gives a lot of meaning, a lot of hope to what an autism diagnosis is. And it, I think in a lot of ways dispels a lot of the myths and stigma that's around it. So Temple Grandin is an amazing human being. She's done so much for the world in a lot of different ways, and also for the community that suffers from that diagnosis. Yeah.
You can also go to our website and find Jay Huffine. He's the clinical director at our Cascades program, and he's written a few articles. So look at his blogs. Go to his profile and look at his blogs, because he's written a few blogs on the subject. So I'm glad you're here tonight, Travis. I wouldn't have had that answer. Although I do know, now that you say Temple Grandin, it's reminding me, but it wouldn't have come to me.
Great.
The next question says, and it looks like Malia just put the link for Jay's, one of Jay's blogs. So thank you, Malia. My son just came home from Evoke after 3 months. Do you have any thoughts about how to generate conversation? So far, he's been talking about the non-therapeutic experience, but not too conversational otherwise. That's his normal affect, but there's a lot we have to get to. Our relationship, school, et cetera, et cetera. Also, now he says he'd like to go back because it's boring here in New York. Any thoughts on that? Thanks. I think it's funny how, and I'm sure you have this in your experience, Travis, how quickly the program becomes a place that they long for. It's really a mystery for many parents early on in the process to imagine that a child is going to think of it so fondly, that it's going to be like when they come home, they're actually leaving home to go home. And so I love that you share your experience. My first thought, and this actually speaks to the work that we do at intensives, my first thought about with your son is always when I'm thinking about changing a behavior, in this case, getting him to talk more, I would always invite you to think about the purpose of the behavior, the why beneath the behavior. So before trying to change the behavior, consider why the behavior is what it is. He might feel overwhelmed. He might feel that it's intrusive, that you're being intrusive. He might feel a loss of control. You know, when you're sent to Evoke, even though he feels fondly about it now and wants to go back, and I'm sure COVID, especially in New York, is going to put a lot of limitations on the kinds of experiences he can have at home. There still is, in this experience of treatment, a loss of control. And so part of what he might be trying to do is maintain a sense of individual sovereignty, of self. Like, I want to maintain control. The last thing I would say, and this is specific to our intensive work that we do with families, consider, this goes back to the why, consider how it might not feel safe for him to talk. There was a disagreement I had with my wife yesterday, and at one point I said, she knew I was upset, and I said, I'm going to take some time for two reasons. I want to downregulate. I want to bring my nervous system down because I was upset at something that had happened. And that would be important. But I also want to make sure that you have time to prepare to listen, because I want it to be safe. I don't want to have a conversation, even if I wait until my nervous system is downregulated, and then have you be triggered by that. So I want to make sure you're ready to listen. Parents will say this to me all the time. People will say this to me all the time. Couples will say this to me all the time. They'll say, I really want to hear what my child or my partner has to say. And I don't mean this literally, but sometimes the question I essentially ask is, are you sure? Are you sure you really want to hear what they have to say? Because it can be hard. And intimacy is not always warm and fuzzy, right? It can be scary. It can be upsetting. It can be painful to hear somebody else's truth. So something I would become very curious about with your son is there anything that you're doing? You can ask him questions or begin to even offer him ideas about why it might be this way. Is there anything that you do in your response to him that makes it feel less than safe for him to talk to you about what's going on for him? So that's what comes to mind. I'll give you first shot at the next question, Travis, but do you have any thoughts at this question?
Oh, I think it's a very common question. I think you're not alone, because there's so much energy that happens in a wilderness experience, and then with the reintegration back at home, it's very natural. And I hear oftentimes from parents really wanting to start getting down to the business of life. And it sounds like talking about school and relationships are some things that you need to be talked about. But, that statement of non-therapeutic talk, I would challenge that a little bit and look at, that any form of communication, the highest form of communication is love. So if there is communication, then there is love. And I really would, encourage you to approach it from a place of accepting whatever is being given to you is enough. And what is not enough for you in that moment is something that we'd bring into the intensives and look at.
Yeah. I'll let you, again, Malia looks like she's posted a couple of blogs from, I believe, Jay on autism spectrum disorder. So thank you, Malia. Thanks for that. Travis, why don't you read this one and take the first shot at it?
My son is at Evoke for 3 weeks now. Reality is setting in, and I really miss him. My son has never been away from me this long. Any webinar geared towards this, I can listen to. Thank you. Yeah.
Well, that's a tough one to hand over to you to have a first shot at it.
It's a beautiful question. It's something that I think it speaks to the real intensity and the shock of what families go through over and over again in this process. So I think one step I would say is find other parents that have gone through that shared experience. Open yourself up to what that feels like and listen to what they have to share, because having the opportunity to be seen in your process as a parent and to be in the presence of other parents who've gone through that, I think can be very reassuring and empowering. And it gives you a window into what's possible and allowing yourself to go through that discomfort versus fighting it off or needing to problem solve. Or, oftentimes parents will jump to that, maybe I made the wrong decision, and then they start questioning themselves. And I think, obviously we want to encourage you to step away from having to problem solve that emotion and just allow yourself to feel it and express it and be in the presence of others who can be there and hold that emotion with you. I think is such an important thing. So reach out, ask for support, find other parents. The fact that you're on this group right now shows that you're doing that and that you're not alone.
Thanks, Travis. I was racking my brain about which webinars, podcasts might be a good fit. I think maybe parental anxiety. I think there's one that I talk about, parental grief, could be helpful. My mind goes to one on attachment, the most recent one that I did on attachment, because part of what I emphasize in the attachment one is that attachment is there's separateness in your attachment, right? That distance and that time apart actually is set up to create a deeper and more profound connection. I remember when my son was going off for his own adventure. It wasn't even therapy. He was 20 years old and he was going away from home for some time leading up to it. And I remember, I've told this story before about being tearful in my own therapy session about his going away. He was my firstborn son, and I was grieving the loss, the anticipation of the loss. And my therapist said, he knows how much you love him. And I thought, that's comforting, because it's not like I'm going to make up for anything these last few days. But then she said something that took away all of my pain. She said, he needs to get as far away from you as he can. And that's my therapist's sense of humor also. And immediately all the pain left me, because I recognized the value in the distance between us and how that would add to his development of himself, and then really allow us later on in life to be connected at a deeper level. My son, who's 18, who's hopefully we're keeping our fingers crossed, who's going to college in New York this coming fall. We had discussed that we might move to New York, and I was even thinking of teaching at the very university that he's going to. And we had a family discussion around the time of his admission to the program, where we all decided, it was very clear to us, that we're not going to go there for a couple of years, and I'm not going to teach there for at least a couple of years, because there's something so valuable for young people in the getting away, becoming themselves.
Yep.
It is, I always say this, that separateness and individuality and identity are the primary ingredients to connection. So I offer this as a point of comfort that your loss and your grief is real. And Travis talked about it, like find other people to share that burden with you. And I'll also offer you the comfort that this is what love looks like for you. This loss, this separation that you're allowing for because this is what your child needs is what the very definition of love. And it's going to, as many of the parents who have been farther along on their journey would tell you, it's going to be a building block for greater connection than you could ever have without it, or maybe you've ever had before this. So that's my thought.
Yep.
Malia's just letting us know that there's a parent support group on May 21st at 6 p.m. Mountain Time. Email malia@evoketherapy.com if you have not received the flyer with the Zoom link. So May 21st, 6 p.m. Mountain Time, malia@evoketherapy.com if you have not received the flyer with the Zoom link. And that's a place to go to like Travis said, to meet with people with a shared experience, maybe people that are farther along than you can offer you comfort because right now you're going through a legitimate loss, a legitimate grief process. Next question. My 16-year-old son is at a residential treatment center in Utah after being in wilderness therapy and a short-term treatment center. He says he is committed to working through the program because he wants to get through the program as quickly as he can so he can come home. He seems to be working hard, but I am worried that he is just going through the motions. How do I know if he is benefiting from the work? You want to take that one, Travis? Or
Sure.
start it?
Yeah. I think it's a great question. I think that comes up a lot. And I would say that, that you have time. And I think that the time is on your side. And the process of kind of determining the criteria of what is success and what is not, I think that one of the best indicators that is in communication. So I would really tune into how you are communicating, how are you showing up, and then how is he reciprocating, or is he not? And I think that that's where I can see that, I've worked with a lot of students in wilderness, which, they can be very successful. And I've also worked in residential, similar to an RTC, where they can get very successful at, working the program. And I think that that's kind of what I'm hearing in your question. Is he working the program, or is he really working on himself? And I think that, some of those questions, I think to lead into that without judgment and without making any kind of assumption, especially if you're trying to communicate that concern in a way that is curious versus fear driven, because if you lead with curiosity and really just try to manage that fear, with an individual therapist, with a support group, but not bring that fear into the interaction with your child, or else your child will interpret that it's their job to manage your fear. And that's where things can go sideways very quick. So I would say curiosity, paying attention to how the communication is going, and really leaning into how you are showing up in that communication, and allowing for some uncomfortable silence, just to allow your child to step into that discomfort and see where they take you, versus you needing to take them to this place of success or doing the work. Because I think a lot of times there's a lot of fear and anxiety for people that are in treatment about really needing to do it on their terms versus it being for mom and dad.
There's a phrase that I use when I think about these kinds of questions, which is adopt a we'll see attitude.
Yeah.
Slow it down for you. It sounds like almost in your question that you're feeling the burden or the pressure of his urgency for time to come, for home to come. And so I think if you slow it down a little bit, if you maintain a curious standpoint, kind of a we'll see attitude, and not get in a hurry. I always think of it this way. When a child is telling you how he or she is doing in a program, if you feel yourself being sold something, take a step back.
Yeah.
Like if you feel yourself being sold on an agenda or a timeline or even a level of progress, I would become curious about that. I think that when I feel that as a therapist or a parent, I notice it, and I don't necessarily buy into it. So, the question that gets asked around this all the time is, to put it more bluntly, is it sincere, or is it just going through the motions? Which is kind of what you said and kind of what Travis was referring to. But I think what people really mean is this. Does it have legs? Is it going to last? You know, there are times when I have made a commitment to a healthier diet. There's times when I've made a commitment to a more disciplined exercise routine, for example. And at the moment I made those, I was 100% sincere. I could have passed a lie detector test, making the promises and telling my wife or somebody close to me that I'm committed to this. And that's not where the gold is. It's not how you're feeling or your energy at the time. It's really about sustainability. I think that's what people are really asking. And time, Travis said this, time is on your side. Take time, slow it down, be patient, err on the side of waiting too long, because if it's true, deep, lasting growth, your child will be patient. Mm-hmm. If it's progress based on a kind of a finite level of energy, hoping for the finish line to arrive soon, then it's going to expose itself through your patience and through your just kind of taking that curious, we'll see standpoint. So those are some of my thoughts about it. Someone asked the question, my son just got there and we need to write the hopes and intentions letter. What are the key messages? We were told to write 2 to 3 pages, but my son has the attention for at most 2 to 3 sentences. What is important, length or message? I think a really effective hopes and intentions letter can be a page. I don't think it needs to be 2 to 3 pages. I think 2 pages is a long one. 3 in many cases can be too long, and 1 is on the short end of okay. So I think shorter is better and be as clear as possible. I used to think that this letter had to pack a really big punch. In fact, it was called something else years ago in our program. It's called an impact letter many years ago. And I, in my early years, thought it had to pack the biggest punch. But the intervention itself does the work. And since we shifted to a gentler hopes and intentions letter with less of a shaming message, less of a kind of a guilting message, and I've talked to our staff about the idea that the boundary does all the work, right? The boundary, the being in the program does really the work for you. And so I wouldn't put too much weight in. I would watch the webinar or listen to the podcast. They're the same recording. One just has video on the hopes and intentions letter. Read the instructions. And then the last thing I will say is don't worry about writing it perfectly. It's the same advice I got when writing a book. Don't write a good book. Just write. And then let the therapist at Evoke give you coaching and feedback. And maybe they'll ask you some questions or ask for some more examples or get more specific in their editing or suggestions to you. But don't put so much pressure. I think sometimes as parents, because of our own upbringing, we put so much pressure on ourselves to get it right or to get it perfect or to think we have to do it just in the right way to push all the right buttons. And that kind of pressure and that kind of responsibility really does take away from your child their responsibility to respond to it. So those are a handful of my thoughts. I don't know if you want to add anything, Travis.
Yeah, I think it was well said. The only other piece of kind of advice or tips I'd offer is that include what is your intention for yourself? What is the hope and the intention that you are doing for yourself? And oftentimes leading with that is role modeling. Essentially, the message is that I'm role modeling a hope and intention that I have for me as mom, as dad, as a person in this world who is in this moment. And by leading with that, you're setting the stage that my hope and intention for you is less about you having to do this for me and just being able to share the hope and intention that I have as dad or as mom and really just leaning into that. And I think obviously following the lead of your therapist, because they're going to have more, just more knowledge of the family system and what's appropriate.
Okay. Want to read the next one?
Sure. I'm clarifying my earlier comment. My son, who just came back to New York, it's boring because of the COVID lockdown. He says that's why he wants to go back. I offered a few nonchalant suggestions that were rejected. I'm thinking it's a combo of what you said before and the reality of life here now. My usual behavior is to ask questions, but I'm wondering if that's not the way to go. My questions are few and strategic anyway, since his tolerance is low.
I think my thought to that is don't try to solve it.
Yeah.
You know, he's shooting him down because at some level your suggestions are, it's not intentional. It's just what happens when somebody gives us a suggestion, when we're expressing frustration, disappointment, hurt, sadness, whatever it is. It minimizes the feeling, right? It's as if to say, I have an answer that's going to solve that. And the shooting down of suggestions or ideas is a way of creating the same kind of feeling in you that he's feeling. He wants you to feel as helpless and powerless as he does. And so any wise, thoughtful, mature suggestion you're going to have, he's going to shoot down. And the feeling you'll walk away with, powerless, helpless, frustrated, that's what he's feeling. It's called projective identification. It's he wants you to feel how he's feeling. So this particular skill, we practice it in our family all the time, and sometimes we do it well, and sometimes we struggle. And I've said this recently on a few of these broadcasts. Try not to be helpful, and I kind of say that tongue in cheek, but try not to be helpful when your children are expressing frustration, disappointment, hurt, sadness, and just try to hear them and reflect back. In fact, I talk about this with therapists all the time, let alone parents. Not having an answer actually feels really empowering to a child, because then they don't feel small. They don't feel like, oh, that was easy for you. And so not knowing an answer is kind of a way of helping them know how big the feeling is, how real it is, and how difficult it is to kind of find a solution. And then you'll find that they'll problem solve for themselves. So my overall thought is, this is a perfect example to not solve the problem, to not be helpful, but just to hold space and to maybe not know the answer. And then give him back the responsibility by this implied not knowing the answer, give him back the responsibility of solving the problems in his own life. Mm-hmm. Yeah. Anything else, Travis?
That's beautifully said. It's empathy, just really being able to step into, what that person feels without it being a problem or an inconvenience or something that needs to be fixed. But the more you can hold that big emotion, not have an answer, not have a follow-up question, the safer he's going to feel.
All right, Travis, why don't you read this next one and take a first shot at it?
My son was at Evoke in spring of 2018. He returned home seemingly in a much better place in terms of his emotional stability. At that time, we thought we were looking at depression and anxiety. After about 5 months, the gains he made were mostly gone. He continued with CBT and his psychiatrist trying SSRIs, SNRIs, and now a tricyclic following several ECT treatments. We also tried 3 sessions of ketamine infusions. The behaviors my ex and I have been seeing over the past several months seem to point to a diagnosis of borderline personality disorder. He is currently in an outpatient DBT program, but he is not showing signs of improvement. And his mother, my ex, says that if things continue along this path, he can no longer live with her. At this point, he cannot live with me either. Any thoughts on a residential program with a focus on DBT?
Well, I'll just answer this first question, and you can answer, and then you can say some more, Travis, and then I'll come back. But we don't give advice about programs over the broadcast. We don't feel like it's the right venue. We believe strongly in the value of consultants, of ed consultants. I've said this many times. I hired a consultant at full price for my own child when I needed help in this area because I trust that process. So I just want to say, I wish I could be more helpful, but I think it would be outside of the scope of our practice, especially in this venue, to give recommendations. So do you have any initial thoughts about the meat of this question?
Oh yeah, it's a lot. Yeah, and I think what I hear is this question about this emerging personality diagnosis, and that there's been a lot of things that have been tried, and now you're starting to see what sounds like emotional defenses that may be more characterological than psychiatric, and that can be very scary. But also, I think in my experience working with folks who have the borderline features is that it can be very scary and there's a lot of stigma around it, but there is also a lot of hope, and there's a beautiful sensitivity in that human being that just needs a place to feel seen and held and felt. And those feelings can be very big and very, very overwhelming. And oftentimes they're using them as weapons. And that can put everybody in a place of defensiveness that then perpetuates the problem. So a lot of emotional safety. I'd say that, whatever places you're looking at, something with an attachment focus, because oftentimes when you're looking at something like a borderline defense structure, that's related to some attachment wound that's deep, often early childhood. And I think that being able to lean into that from a place of your own feeling of self-care, because for parents that go through this, it can be overwhelming and exhausting, and it pushes people to their limits. And I always say that self-care for families in whatever diagnosis and treatment modality, but especially if you're working with somebody who might have a borderline personality disorder, that's going to be really important.
Yeah, I like the attachment focus, of course, because it does say in the diagnostic manual clearly. It doesn't say this with a lot of the other diagnoses. It attributes that attachment fracture as being a part of it. I think the DBT is great for managing day-to-day safety and behavior. The research is exhaustive on the effectiveness of DBT. So you're barking up the right tree, so to speak. There's a principle from my training and working with borderline personality disorder that informs me every day, in nearly every relationship. My therapist, who was working many years ago in a state hospital with a group of borderline personality disordered individuals. And she said she was actually entertained by how well these patients were making the staff go crazy, running them around. And somebody said to her one day, her supervisor said to her while working with them, it says, with borderline personality disorder specifically, and I think this applies to teenagers, a spouse, a friend, really just everybody, but specifically for borderline personality disorders, you don't get to win, you get to choose how to lose. Because the name of the game with borderline is you lose, end of game. They want, again, back to projective identification, they want you to feel as hopeless as they do. And so if you say white, they'll say black. If you say red, they'll say blue. If you say yes, they'll say no. I think there's a story in my book, I changed it a little bit, but essentially watching a therapist work with a client who was diagnosed with some borderline personality disorder features. And I was watching this therapist try to make it okay, try to win. She was trying to win with her client. She was saying, look, I gave you extra sessions last week. I keep trying. And of course, the client was saying, you don't love me. You're laughing at me. You hate me. You're just in this for the money. The child had a pretty significantly traumatized attachment history. And I won't get into all the details, but it was significant and pretty overt. Sometimes it can be more subtle, like Travis was alluding to, but this one was really overt and clear. And after watching this therapist try to win with the borderline client over and over again, I said, can I try something? And everybody agreed. And I said, I don't think we can make this better. I think in a way, if we made this better, it would diminish the kind of pain that you feel. And there's no way we can repair what has happened to you in your life. And so I think what you need to feel is you need to feel angry and scared and not sure of the connection that your therapist has to you, or me for that matter. And even if we did a remarkably wonderful job, you're only going to know us for a couple of months. And then you're going to go back into life, into an environment or a context, a life where these really traumatic things have happened to you. And while you might not know the traumatic things that happened to your child, the goal is to get you to feel how they feel. And it's not a conscious goal. And I love the liberty. I love the empowerment and the liberation that comes from that idea of you don't get to win, but you get to choose how to lose. For me, even in the relationship with my wife or my children, none of whom are diagnosed with borderline personality disorder, it reminds me to just speak from a place of my truth, to allow people to have their feelings, to surrender to the idea that I can win, that I can get it right, that I can make people feel how I want them to feel. So I think there's some great work in that idea for all of us. In my book, the last chapter, I talk about the 3 keys to enlightenment. I talk about learning how to lose and learning how to own your own mental illness. Those are a couple of ideas that come out of this suggestion that my therapist gave to me that she got from her supervisor. So those are the things that I think about related to borderline personality, but also I think it can be helpful for all of us parenting anybody or in any relationship. As grandparents, how can we best support our grandson who is at Evoke and support his parents as well? Um, this is my favorite question to be asked because it goes at the heart of our message, which is do some of your work. The greatest, most generous gift you can give to your child and your grandchildren is showing up here tonight. Read a book that your grandchild has been asked to read. Watch some of the webinars. Listen to some of the podcasts. Learn what they're learning. I mean, I'm of the notion and believe that we can all benefit from therapy and from self-help literature and psychoeducation. So what they don't need from you is they don't need you to come with answers. They need you to come with empathy. They need you to come with the generosity of doing some of your work. The highest compliment to your family, to their work would be to say, I learned something about myself today. I realized something about my childhood. I didn't know this, or I didn't know that. Or just come with questions like say to your grandchild, what have you learned? Maybe you're going to help undo some of the cycles that I inherited from my parents, that I passed on to your mother, your parents, and that she and they passed on to you. That's the most heroic, generous gift that you can give, which is doing your own work. Read one of the books that we recommend. Listen to what we talk about, and come with questions instead of answers. Those are my thoughts and ideas. Travis, what would you add to that?
Yeah, I think that was really well said, and I just recognize how powerful it can be for a child to see that the adults in their life are learning and growing too. And when you really lead and show up that way, it changes the script, and whatever that script may be, that's a narrative that oftentimes needs to be deconstructed and rebuilt. And part of that narrative is that everybody has emotional work that they can learn and grow from, and that I think for kids especially to be able to separate themselves from this identification as being the problem. And I think when they see that we all share a part of the problem, we all share part of the solution.
Awesome. Travis, why don't you take the next question, the next shot at the first shot at the answer.
When, if ever, is it okay to share how you are feeling with your child in regards to concerns over risky or past behaviors that are causing distrust on our part as parents? For instance, my 7-month sober son shared wanting to help a friend get sober and was with the friend when he had his last high. I did not respond, but I am sure my anxiety was palpable. I did manage to ask him how that made him feel, and his answer left me feeling he is again overconfident in his sobriety. I would like to have a conversation around this, but do not know how to do that without sharing how it makes me feel.
You want to take a shot at this one first? This is one of my soapboxes. So
yeah, this is a soapbox. I don't want to step into this. You go first.
Okay. Very lightly. There's actually another question on our list that says, if you teach I feel statements at Evoke, when is it appropriate to use them with our children? And I wrote in the new book that I'm almost at the point where I don't want parents to share their feelings with their children. And I say almost. I even make the point in the book that I'm saying almost, and people still don't hear almost. You don't want to make the child feel responsible, and you don't want to make the child feel like it's their job, which is the same thing as being responsible, to make you feel your serenity. In Al-Anon, we learned that our serenity is our responsibility. If I were in this situation to share with a child, I would share it lightly. I called it holding your opinion and feelings lightly. What that means is if the child has a reaction to it, you can back off and let it go and drop it. At most, I would say, hey, I have a thought. Are you open to it? I've something's coming up for me with this. Are you open to it? And if they say yes, they might still be testing you to see if you're going to be intrusive. I would say, for me, I just have a little bit of fear and anxiety about the trigger that it might be to be around this person. And that, for me, when I've been in situations where I've tried to pull somebody up, sometimes I've been pulled down by their behavior. And so I don't know if it fits for you. I don't know if it applies or not, but that just came up for me. Take it for what it's worth. If it doesn't fit for you, that's okay. So you'll notice in the way that I described it, I'm holding it very lightly. I'm not saying it as if it's the truth. I'm sharing a feeling, but I'm personalizing it to be about this is what it's been like for me. So in the webinar podcast that we have called the 8 Tips and Tools for Transforming Relationships, it's really about not sharing advice, but sharing your experience, what works for you, and be very, very careful to steer away from sharing feelings with your child about your child with the implication that they then have to be better, show up a different way, not do something for you to feel okay. So why I say almost at the point of asking parents not to share their feelings with their children, the reason I say that is because I think it's rare that the average typical parent shares feelings with their children without the underlying hope, expectation, belief that it's the child's job to take care of their parents' feelings. So that's why it's a soapbox for me, because I'm passionate about it. I don't know, Travis, anything else you want to add to that?
That's great. Yeah, and I really appreciate the coaching around that, because I think it really brings an important distinction. And I would say that in my kind of early years of starting as a therapist, I would lean heavy on trying to get parents to be able to share their emotion, because oftentimes emotion was acted out, but not actually spoken and named. And I think that, this type of coaching provides, I think, a really, really important lens to it, so that the motivation for change or the motivation for introspection isn't based on trying to make my mom or dad feel better. And I think that that's really where the coaching is at. So that the sharing of an expression of emotion, first step is don't act it out. That you can be able to name what the feeling is. And the second step is that you make a very clear statement that there's a boundary around this emotion. This is mine. And I'm going to figure out a way to be able to sit with my fear. I'm feeling anxious. This is not your problem. This is something that I have to work with. And I think that that's a really important distinction.
I love that. I think that I think it's critical that we front load and then on the back end make it clear and be repetitive and say, this is my feeling and I'll deal with it. And I have resources, meetings, sponsor, therapists, your mother, your father, my friend, that I can deal with it. And so instead of leaking it or acting it out, if you're going to say it in the moment, you can say it like that, but then demonstrate that you have resources to take care of it so that the child doesn't have to. I think that's a really important aspect of it. Malia, it looks like there's no new questions. I think I have some from my list. Somebody asked this question. What is the music from played at the start and finish of these? It's called Follow You Out by a band from Utah named Diagnoses, some friends of mine. It was the only one that I could get easy. I love their music, but it was the only one I could get easy permission for using at the beginning and the end. Someone says, I don't fully understand why not sharing feelings. Isn't that holding back or walking on eggshells if we don't tell them how we feel? Shouldn't all relationships convey how things make us feel? Why wouldn't I tell my son how he makes me feel? So 3 women get on a bus in New York City. And they're kind of getting on and then kind of confused. And the bus driver yells at them in this thick New York accent, tells them to get their keisters on the bus and because he's got a bus route to make. And the first woman is absolutely tickled, thinking this is perfect New York culture. And the second one just hears it as a direction. It's neutral for her. And the third one is completely offended at the rudeness of the bus driver. So the three separate reactions, did the bus driver really make any of them feel what they felt? Or is it a combination of the bus driver showing up as they were, and then these tourists taking it in a way that really represents what it meant to them and where they were at that day, that moment, or in their life? And so we don't really talk about makes me feel. The problem is with makes me feel is if they make you feel a certain way, then you can make them feel a certain way. Then if they're responsible for your feelings, then you're responsible for their feelings. And we're trying to teach them to own their feelings. The shift in the I feel statement is about ownership. This is a critical piece. I think when I was a young therapist, I think I used the words, the I feel statement was about choosing to feel angry. I don't think these women in this silly little example, I don't think that they chose to feel anything. Right? There was no conscious choice. It just reacted with their makeup, with how they were doing that day, and it came out in them the way that it came out. It came out for them in the way that it came out. So I feel statement is not I choose to feel angry, I choose to feel sad, I choose to feel hurt, I choose to feel happy. It's mine. If I were sitting next to Travis right now, and I went to pat Travis on the shoulder, and he kind of jerked in fear because he had been, let's say, abused physically by his father. This is all just hypothetical. And then Travis said to me, "Hey, Brad, when you reach out and touch me without asking, it kind of triggers me, and I feel afraid sometimes because I have some history in my background around kind of unkind, unloving touch." I didn't cause Travis to feel afraid, right? Now, if I'm his friend and he's asking me for something, I can, of course, not touch him again without asking for permission ahead of time. And this is the key. Over time, in this analogy, with therapy, Travis can, quote unquote, choose to not feel afraid by understanding through a healing process in therapy that not everybody that touches him is trying to hurt him. But that's not the kind of choice that you and I think of. So the problem with handing our children our emotions, it's really about semantics. The problem with handing our children about our emotions, you make me scared, you make me frustrated, you make me angry, is then they grow up with the belief that what other people think and feel about them is about them. Then they go out into the world with partners and with peers, and they assume that if somebody's mad at them, it's about them. And then we wonder, why are our children so susceptible to peer pressure? And the answer is because we taught them. We taught them that my feelings, Dad, my feelings, Mom, are about them. So this is a deeper level of coaching than kind of typical communications theory. It's more complex than just sharing your feelings. You occupy a different space in your child's psyche than anybody else. And you occupy a different place in their psyche than they in yours. You weigh heavily on them. And if you're upset and they're taught that it's their fault, the chance of them developing a self diminishes. The goal in life for all of us is to realize that what other people think and feel about us is not our business. That's what you learn in Al-Anon. The shame that people are self-medicating with addictions or other symptoms is often exactly what we're talking about. It's trying to take away the pain and the weight of believing that they're causing everybody else to feel upset, disappointed, scared, sad, frustrated, angry. So while in popular culture, we might think that the simple expression of a parent to a child is just part of a kind of a normal society thing, we learn from child development and psychology and attachment and from recovery from codependency and addiction that the root often of mental illness issues and addiction is the child believing that he or she is responsible for the adults and their lives' feelings, happiness, and serenity. So there's lots of webinars on this. Both of my books talk about this, but it is a critical, difficult, complex, and subtle idea to kind of come to grasp with. So I really, really love the question. I know I talked for a long time, Travis, so I may have taken all the wind out of it, but anything to add?
The one piece I would add is that as a parent, you're learning and you're growing. And I think that if what Brad just shared with you is kind of a novel or even somewhat, counterintuitive, kind of mindset, I think it's important to be able to role model that authentically. And you can use the language like, a part of me, or, in the past, I would say that you're making me feel angry right now. But what I'm realizing now is that you are not responsible for my anger, that's mine. And so I'd like to use a part of me, or in the past, like that was then, this is now. So you're creating a framework where you're giving yourself some space to be emerging, that this concept hasn't fully been integrated, and you're trying to work and practice and what that's like to live that way. And you're not fully there yet, which in a lot of ways is where we all are. So giving yourself
like that.
Yeah, we're it's a work in progress. A part of me wants to feel like you made me feel that, but I'm realizing now that that's actually my emotion, and you didn't make me feel it.
I think we're going to wrap up right now, and I'll kind of end with the thought that it is a work in progress. It takes a while to realize what it means to be a self and be connected to another. And these things are not intuitive, and they're not taught by the dominant culture. That's why we have support groups like Al-Anon and Codependence Anonymous. And that's why we have a program that commits so much energy to parent education, because this is not common sense. What you will find invariably, and those of you who've been on this journey longer will tell all the rest of those that are newer to this journey, is what was once foreign and strange and even seems so antithetical to what it meant to be a parent, now is something that seems so simple, so automatic. And it takes time. It takes years, to be honest with you, to kind of make some of these shifts as a parent, as a father, mother, even as a therapist. If you watch my webinars, which we don't publish anymore, from 12 years ago, you would not have heard this emphasis, because I was still shedding off some of the ideas of the dominant culture that I grew up with. So thank you for joining us. Thanks, Travis. I've never done this before where I spontaneously ask someone on. So thanks for taking the leap with me.
Yeah, absolutely. It was fun.
And just for upcoming announcements, check our website, email malia@evoketherapy.com for any questions about upcoming online intensives or intensives. We're planning on opening up our in-person intensives toward the end of June. We're scheduling that tentatively right now. So we're taking admissions for that time. So we're looking forward to that. Check our website. If you haven't checked our website out lately, we have an updated website with free resources accessible even on that front page. The parent support groups that Malia is talking about, intensive support groups. And in the end, thank you for, on behalf, showing up to something like this and being willing to be a student, being willing to consider new ideas that may be foreign. You're really doing exactly what you're asking your child to do, which is to be open to some new idea, some new way of being. So for, on behalf of your child, I just want to commend you and thank you for showing up tonight. So take care, folks. Bye-bye.